Patient presented with complaint of multiple retained deciduous teeth. The clinical picture is suggestive of which of the following? The answer is cleidocranial dysplasia. In this picture, you can see is the dental. In this picture, you can see is the clavicular abnormality, suggesting cleidocranial dysplasia. Now, what is cleidocranial dysplasia? It is a generalized bone disorder caused by mutation in RUNX2 gene. Which gene? RUNX2 or CBFA1 gene. So this gene normally guides the osteoblastic differentiation, chondrocyte maturation, and bone formation. So what are the defects or the clinical features that you will be able to see in the cleidocranial dysplasia? The bone defects chiefly involve the clavicle and the skull. The clavicle in this picture represents these are hypoplastic bilaterally, or the clavicles are completely absent. The patient neck will appear long and shoulder are narrow with mark drooping. The clavicular abnormality that results in unusual hypermobility, and the patient can approximate their shoulder anteriorly. What are the other features associated with cleidocranial dysplasia? The additional features include short stature, enlarged skull, brachycephaly, pronounced frontal and parietal bossing, ocular hypertelorism. On the skull radiograph, you will see fontanelle that show delayed closure or remain open throughout the life. The patient often had a narrow high arch palate and there is increased prevalence of cleft palate. For the teeth part, you will see the teeth that are over retained deciduous teeth and delay or complete failure of permanent tooth eruption, that are the characteristic feature. On radiograph, you will see presence of numerous unerupted permanent and supernumerary teeth that exhibit distorted crown and root shape. So on the panoramic radiograph, you would see is the multiple unerupted teeth.